Hi, I'm Dr. Promila Mehan, and in this video I would like to give you some tips on how to prevent your teeth from cracking. Now, our teeth are protected by a hard outer shell called enamel, but there are a lot of things that can weaken this enamel. First is your diet, which can cause cavities, and a cavity is a hole in your tooth. Acidic foods and carbonated beverages can cause erosive wear of your enamel, making it thin and more prone to fracturing. Teeth grinding. Teeth grinding can create a lot of excessive forces on your teeth for extended periods of time, making your teeth more prone to cracks. Also, if you have large fillings, if you have a really big filling on your tooth, the outer walls of your enamel tend to be very thin. So the repeated action of chewing and grinding over years and years can make that enamel weaker, making it more prone to fracturing. Also, if you have habits of holding things between your teeth, such as pencils, pens, whistles, flashlights, that kind of excessive force can make your teeth prone to cracking. And if you like to chew really hard substances such as ice, you will definitely develop cracks in your teeth. So what are some signs and symptoms of cracks? Well, in the early stages, quite often there's nothing. It's something that I often will discover during a routine dental hygiene exam. Over time, you may start to experience some hot and cold sensitivity and eventually pain on biting. So what should you do if you do feel like you have a crack in your tooth? Well, call us and get it checked. Because a crack in a tooth is similar to a crack in a windshield. When it's small, it's just a simple job of putting a filling or repairing that crack, and the job is done. If you allow that crack to sit there long enough and to progress, sometimes it becomes large enough that I may actually recommend a crown. So a crown is like a helmet on your tooth. I put it over your tooth and it holds the whole tooth together and protects it from breaking. Now, if the crack progresses further from that, sometimes the crack will go down the roots of your teeth. Now, if the crack actually goes down the root of the tooth, it's game over. There's nothing more I can do, and usually that tooth would need to be pulled. So how do you prevent these cracks? Well, the first thing you can do, brush and floss regularly to prevent cavities. Eat your acidic foods and drink your carbonated beverages in moderation and rinse with water afterwards. You may want to consider getting a bite splint, a nice thick hard piece of plastic that goes over your teeth. Always make sure they're custom fitted. A bite splint will go a long way to protecting your teeth if you're somebody that grinds your teeth. Avoid eating hard foods. Please don't chew on ice and don't eat hard candies and candied nuts. They're lethal for our teeth. And lastly, regular dental checkups and cleaning so that we can identify these cracks and treat them in a timely fashion. Thanks for watching this video. Please subscribe to my YouTube channel to continue to receive dental healthcare tips. Have a great day.